You're listening to localwebradio.fm.
Welcome to the Healthy Smiles Oral Health Show with Dr. Norm Ickert, brought to you by Ickert Dental Implant Centre, where they are committed to providing you with the very best in modern and advanced dentistry. Now, here's your host.
Hello, this is Nick Jaworski, and of course, I am your host today, and I'm here with Dr. Norm Ickert, director of the Ickert Dental Implant Centre. And today we'll be talking about dental implants and what you can expect to happen during that preliminary examination process. Now, before Dr. Ickert joins us, just a reminder that if you have questions or require any sort of assistance, you can always call Dr. Ickert's office at 604-881-1381. That's 604-881-1381. Dr. Ickert, it is great to be talking with you today.
Thanks, Nick. It's always nice to be here.
Now, we've come a long way in these last episodes, and we're starting with sort of the preliminary dental examination, and now we've worked our way all the way up into dental implants. It's been a very consistent march towards this point, and so we got a lot to cover today. So let's just get started. And what should I expect during that preliminary implant examination process?
Nick, it's actually interesting that you introduced this subject the way that you did, talking about the long march to get to this point. But it really makes me feel like we did it the right way, because we started out with the initial subject of oral health and then getting involved in medical and dental history, because implant dentistry isn't a standalone type of service. It is just one of the treatment options that we have, which belongs to the whole concept of dental treatment. So if you were to get a root canal or a crown or anything else done, you would also first have a full medical and dental history taken, because everything that we do is a part of the overall part of the body. So, for example, if we decided to do a dental implant, but we realized that the patient was taking a certain medication that deals with osteoporosis, that might seem like a fairly innocent thing to put on the medical history, but as far as dental implants are concerned, it has fairly significant ramifications.
Right.
So having a sense for the patient's overall health is really, really important. So I feel that isn't just something that we try to check off a list or do flippantly. I really believe that the medical history is really important, because we can figure out so many things, even in terms of how does the patient heal. For example, if the patient had diabetes and it was somewhat uncontrolled, which it often is, that's going to have a significant impact on the outcome of that procedure. Or if the patient is a smoker or has any other types of autoimmune disorders, those are all issues that would make a significant difference with the outcome.
Yeah, for sure. Yeah, I think that listeners of this podcast, I think that it's been the amount of knowledge we have to get us to this moment is fantastic. I've enjoyed it, and I'm excited for this next step. I'm ready to go to learn about now the implant process.
Yeah, and so we get excited about the implant, and I certainly do as well. It's a great procedure to perform, but it can only be done in the context of having a very thorough understanding of the medical and dental history, understanding the risks in those areas, and, of course, performing a thorough oral exam, because more than anything, and I think I tried to make that clear in the first couple of sessions, that our biggest responsibility is just general health. And so if we see some lesions that don't look normal on the cheek or on the tongue or other areas in our area of expertise, it's important that we assess that, and that certainly takes priority over the dental implant. So I really like to perform a thorough, comprehensive examination, both extraorally and intraorally, just to get a general sense that the patient is relatively healthy and stable to move forward with implant dentistry.
Well, okay, so we've gone through that process. Is that a separate process than the preliminary examination that someone might receive when they go to get implants, or is that part of what you're calling the whole examination process?
In our case, this is what every patient gets when they come to our office, because our patients are oftentimes referred from other dentists, and we don't have a long-term relationship with some of these patients. So it's our duty to really get an understanding of the overall health and well-being of the patient, both medically as well as dentally. But then once we actually get into the mouth, so to speak, and we've cleared the patient medically, now we actually look at everything in 4 specific areas. I know we've touched on this before, but it's good to review that we look at the mouth in terms of the periodontal health, which means how healthy are the gums and bone of the particular situation. How healthy is the patient from a structural standpoint? In other words, how strong are the teeth that are remaining? Then we have to look at, well, how well do these teeth actually function? How well do the jaw joints function? How is the speech? How is the swallowing? How is the saliva in the mouth? These are all things that lead to a functional assessment. And then finally, and just as importantly, is what about the aesthetic assessment, and what will this implant do for the patient aesthetically, both good and bad, because there are significant risks with certain types of implant treatments that if we don't take the aesthetics into consideration, it could end up being a nightmare. And of course, that's what we want to totally avoid.
Right. So how do you go about examining these 4 areas?
Well, we have a very specific checklist that pertains to each one of these areas, and we systematically go through this. And we won't have to go through each individual point in this podcast, but there is a very specific protocol that we follow. It's very systematic, and we focus on trying to make a diagnosis. And it's different than just assessing a symptom or a finding, but we actually want to know. For example, if we look at the mouth and we check for the teeth in terms of their tightness or their so-called looseness, if a tooth is loose, that's one thing. That's a finding. Or if you tell me that you have a loose tooth, that's a symptom.
Right.
However, it doesn't tell us why the tooth is loose. So what we need to do is to find out why the certain finding is in place. So for example, if the tooth is loose, it could be loose because there could be an infection around the tooth, which has made you lose bone. So once the infection is cleared up, that tooth might tighten up. Or the tooth could be loose because you lost bone from gum disease or periodontal disease. Well, that's not going to tighten up on its own. Or the tooth could be loose from excessive forces. In other words, you could have a grinding habit, or you could have a bite that's creating excessive forces on your teeth, still making the tooth loose. But if you take care of the actual problem or the bite problem, that tooth will completely tighten up again. So you could have a loose tooth with a completely different reason. And so the important part of our examination is to figure out the why. Why is this situation the way it is? In other words, make a diagnosis. And once we make a diagnosis, now we can establish a risk assessment, which will help us establish a prognosis. Because the prognosis is really the expected outcome of the case without doing anything. What's the prognosis of this particular patient keeping their teeth for the rest of their life if they do nothing? That's really what a prognosis is. Then, once we actually institute treatment, then we can get a prognosis for the outcome following the treatment. But initially, when the patient comes in, I want to know what is the prognosis of this patient in terms of their gum and bone health, their structural health, their functional health, and their aesthetic well-being if we do nothing. And from there, we assess the need for treatment, because if you have a low risk and a good prognosis, you don't need me. That's not the issue. We want to find the situations that have a high risk and a poor prognosis. That's where we can be of help to our patients.
Now, we have to take a quick break, but when we come back, we're going to talk a little bit about something called a CBCT scan and the other kinds of x-rays you might do. So we'll touch on that, and we'll be right back. Don't go anywhere.
More Healthy Smiles with Dr. Norm Ickert from Ickert Dental Implant Centre after this.
If you've been known to enjoy a nice glass of wine, be sure to tune in to From the Vine to the Wine with Matt Berzovich on the Lifestyle Channel on localwebradio.fm. If soccer is a part of your life on the Semiahmoo Peninsula, be sure to tune in to This is Soccer with Chris Murphy, Executive Director for Coastal FC on the Community Channel on localwebradio.fm.
Would you like to get more from the devices you own? Not quite sure where to start? There is help. Catch Powering Up for Non-Techies with Justin Martell, Computer Department Manager at London Drugs, on the Specialty Channel on localwebradio.fm.
It's time now for more Healthy Smiles with Dr. Norm Ickert.
All right, we're back, and I'm talking with Dr. Norm Ickert, and we're talking about that preliminary examination process. And Dr. Ickert, I understand that there's a variety of different imaging processes that you might have a patient, undertake would be the word for it. Can you talk about that a little bit?
Sure. Nick, when we do an exam, we try to take as much information as possible into consideration. And so obviously we use our eyes, we use our ears, we use our smell, we use our touch. I mean, we use everything we can to figure out what's going on. So clinically means that we look at the patient with our eyes and we touch and we feel and we palpate and all those things, which gives us a good sense. But obviously we can't see through the gums, through the teeth, or through the bone, so we can't see what's actually going underneath. And that's where so-called imaging comes into play. And there's different types of imaging. We like to maybe call that X-rays, but today with digital technology, there's been such an amazing growth in this area that gives us so much information, because most X-rays that we're used to are basically two-dimensional X-rays. They just give us the height and the width, but they don't actually give us the depth of the object that we're looking at really is. So now, with these newer technologies, we have the ability to scan the patient, and via a very complex arithmetic algorithm, this data can be manipulated to actually provide a three-dimensional volume that we can see on the screen. So we can actually see how thick the bone is, we can see where the nerves are, we can see how deep the sinuses are. We have this amazing ability to see right through the patient prior to surgery, so we know exactly what we're dealing with. And the nice thing about this so-called CBCT scan, which is oftentimes misinterpreted as a CT scan, but that we know of in the hospital, even though it provides the same type of information in terms of its three-dimensional volume, it isn't a true CT scan. Just the way it functions from a physical standpoint, it is a wonderful way of getting this information without the incredible high dose of radiation. So we can provide the service in a dental office with a significant reduction in radiation, which makes it such an attractive tool to have for us in the office.
Yeah, that sounds great. Now, what the CBCT scan, how does that work? Like, what is the process? Do I get out of the chair? Is there a separate room? Is it in the seat? How does that look?
Yeah, that's the beauty of it now, that the actual so-called footprint for this machine is pretty similar to what most of us know as a panoramic X-ray, where this machine spins around your head and it takes this so-called panoramic X-ray. And that's very similar to the type of machine that we use for a CBCT scan. Of course, the technology is different and the cost is significantly different in terms of the purchase of this kind of machine.
Right.
But the actual look of it is very similar. So the patient gets up out of the office. If the dentist is lucky enough to have it, one of these scanners in their own office, it's done right in office. Otherwise, it can be referred out to any number of facilities that have this kind of scanning technology available.
All right, so we've got this CBCT scan. Is there anything else that you would want to include in this preliminary examination?
For sure, Nick. I mean, we also use the scan, by the way, to have a look at everything else that shows up on that scan in terms of nerves, in terms of any kind of issues in the bone or in on the teeth themselves or in the sinuses or in the jaw joints. I mean, it gives us a lot of information. So we do a general scan of the entire area, so-called the volume of the scan that we obtained. We assess more than just the site where the implant is. Now, the other thing that we look at in our exam is the bite. We have to make sure that the patient has a healthy bite that will work well. Another really a simple thing, but very important, is we check the maximum opening on every patient. Because if you can't open your mouth more than 30 millimeters, then you're probably not going to be a good candidate for an implant, because we can't get our instruments into your mouth. And basically, what we're looking for, if you would just hold three fingers together and try to put three fingers in your mouth, that would be a normal opening. That ranges anywhere from 40 to 45 millimeters on the average patient. So that becomes a very important measurement for us to take, especially if we have to do an implant in the back of the mouth. Now, we also check for any type of diseases in the mouth, especially for so-called periodontal disease or gum disease, because those bacteria tend to invade the site of the implant. So those are really important issues to solve or to at least assess beforehand. And then what we also do just to complete our overall examination is to take photographs of the patient, just simple clinical photographs that help us to view different areas of the mouth and the face. And we put all this information together to come up with a comprehensive treatment plan designed for the specific problem that the patient presents with.
Well, it's great to know the process that we can expect going in. And next time we'll talk a little bit more about implants and about those first meetings. And so if you know someone who might benefit from what we have talked about here today about this initial exam, please go ahead and share this podcast with them. I'm sure that they will thank you for it. Of course, you can reach Dr. Ickert at www.ickertdentalimplants.com. That's ickertdentalimplants.com. And you can always reach his office by telephone at 604-881-1381 or call him toll free at 1-866-931-1981. Dr. Ickert, as always, thanks so much.
Thank you, Nick.
Thanks for listening. At Ickert Dental Implant Center, we are committed to providing you with the very best in modern and advanced dentistry. If you would like more information about dental implants and our extensive range of specialized dentistry services, please call us today at 866-981-1381. That's 866-981-1381. Or visit us on our website at www.ickertdentalimplants.com.
Local stories, local voices. We're localwebradio.fm.
This episode is a production of Jam Media. For information on hosting your own web radio show, visit jammedia.com. That's www.jambmedia.com.
The opinions expressed by our guest and host on localwebradio.fm do not necessarily reflect the views of Jam Media or its owners. No expressed or implied opinions of any product or service should be considered an endorsement or recommendation of any kind by Jam Media or its owners.